You know, I was struck by the information we received from the city clerk, Suzette Davis, concerning when they start decorating this place. October to get it all ready for Christmas. And if you hear that background noise, folks, that's because, in fact, they're putting up decorations on the city hall. They're finishing that up right now, the electricians and decorators. But we're pleased to welcome now David Culpepper, Marketing Director of Covington County Hospital. David, good to see you. Thanks for coming on.
Oh, absolutely. Good to see you this morning, Gerard.
Covington County is rocking with the big Christmas parade scheduled for tonight in Collins. And Suzette says get here early to get a parking spot because the place is going to be packed. The streets will be lined.
Probably shortly after lunch you need to be lining up.
They
come out of the woodwork, man. I'm telling you, it is unreal. I guess it's just kind of the quintessential small town in Mississippi, that Christmas parade. Everybody comes to the Christmas parade.
It's fun.
It's fun. It's an opportunity to see everybody and kind of, I guess, officially kick off that Christmas season and have some fun. Yeah, and you know, with Thanksgiving, we've talked about this on the program, being late in the year. I think Rhino advised us that that happens comes around every 10 years, late in the month of November, the final week. And so, boom, Thanksgiving's over. You're right in December. You got 3 weeks and it's Christmas. So a rather compressed schedule. It is. It's compact. Between now and Christmas Day. Tell us how things are going at the hospital. Well, things are going really well at the hospital. We're rocking along, trying to take care of the community, doing the things we're supposed to do, just trying to keep the community healthy and be of service and continue to grow. You know, we've got some growth that's going on right now with the Smith County Emergency Hospital, the expansion of it, and fixing to open it up right after the first of the year. So we're excited about that opportunity to bring that health care to that part of the state and continue to reach out and partner. And it's a story in healthcare that you don't hear nowadays. Mostly it's closings and people under tight clamps and things like that financially. But, obviously we're not just rolling in the money, but we've been very judicious with what we're doing and trying to reinvest back into the community and put healthcare services where they need to be. Are you cash flow positive? Yeah. Okay. We are. Because there, as you know, a lot aren't. A lot are not. A lot are not. And in the state and in the country. Yeah. Our CEO, Greg Gibbs, does an awesome job of keeping us, I guess, lean on the staffing side, but also challenging us of ways to do things better, smarter, more efficient, more cost-effective, which any business is doing. So it's not, he's like, we don't need to, if we can eliminate waste, eliminate it. Yeah, sure. I see you've brought some statistical data there. You want to share that? Yeah, absolutely. University of Southern Mississippi created an economic study for the project in Smith County. It's going to create 56 new jobs, $30 million in annual economic impact, over $150,000 in annual local taxes generated from opening this up, and an additional $254,000 in annual state taxes generated off this. And that's, 36 direct healthcare jobs, 14 suppliers, and 6 retail jobs created off of that. So we're very excited about that. The biggest thing is Smith County, Raleigh, Mississippi has not had emergency services in probably 25 plus years. This is going to fill a gap when time is of essence, that you've got somewhere to go to get you stabilized if you need to be stabilized and shipped. It'll also give you an opportunity to go be seen and discharged and taken care of and be able to go back home and follow up with your provider if needed. So it's filling a huge gap there, not only in Smith County and Raleigh, but that area of the state as well. And it's, we've been very well received by the county and the city in Raleigh and Smith County, and excited about the partnership, and they're excited about us being there. I mean, there's some situations, are there not, talking about medical situations where, as you say, time is of the essence and you need rapid access to emergency services, at least to get you stabilized to that point where then you could be transported perhaps to another facility that can take it from there. For higher, to get you where we're really good about, and we've won numerous awards at Covington County for cardiac care. Okay. We don't publicize those for the simple fact we don't do cardiac care. Okay. But what we're judged on is how fast we get you in the emergency room and get you transferred. And there's many cases where from the time the call goes in till you get back to the emergency room and you're within 45 minutes of the call, you're sitting at wherever we transferred you to. We've gotten you stabilized and gotten you ready to transfer and have you sitting at the other facility within 45 minutes, which is extremely, extremely good. Yeah. I mean, there's lots of technology that has
come onto the scene in the last several years that's really improved that process dramatically, that first kind of response there.
Yeah, and our EMS teams, they're very adept with understanding the signals, the science, what to look for. Okay, we're going to go ahead and get this started on the scene so that when you get there, this process has already started to recover. And if you've had a stroke or something like that, we can go ahead and start getting you to a point where we can kind of stop that and start getting things moving in the right direction.
Yeah, makes total sense.
It does. And, we're Raleigh and Smith County. It's 30, 35 minutes to Laurel, to McGee, to Collins. I mean, you're just kind of in the middle.
Yeah. Hattiesburg, got Forest General down the road there as well. So, and then hour 20, hour 30 to Jackson to the concentration of the hospitals in that area.
Yes.
But so this is a need we have across the state, though, is it not?
It is.
Where we need to have some sort of at least initial emergency care that's readily available in some of these communities.
You do, because you've got a lot of counties that may be covered by, depending on the budget, may be covered by one ambulance, 1.5, or a half ambulance. Depending on what the contract is with that company. And that's, it's based off of what the county can afford. But again, you've got a large area that's not being serviced, and it takes you a while to get there. If you've got an ambulance on a call and then they go on a transfer, then at that point, that's a deadhead run for them. There's nobody to answer that call. So they have to reach out to another agency in the area to cover, or find someone else to take the transfer.
I see.
So, and it's not, it's not a knock on EMS. I mean, it's just the way it is.
Yeah. So we've got change in administrations in Washington. Anything that you in the healthcare industry are paying attention to that might affect you?
There's a lot of things right now on the Hill that, there's some things tucked away in some bills that probably need to be looked at that I don't know. Of course, you know how that is. It may get looked at, it may not. It just may be part. It may be part of the rollover piece that we got to get this done, and that's just part of it. But that there's some things there with CMS and some rulings there. It's going to be interesting to see how all this stuff with those Ozempic and how that falls out, and the charges, and how CMS covers that if they cover it. So a lot of those changes are coming down the pipe. So, but I think consumer and the using the drugs, the administration of the drugs, and all that's going to play a big role in that as well. Yeah.
Well, I think it's a different attitude towards healthcare, and of course we've got an incoming administration that is going to be looking hard at federal spending, and as you're well aware, a lot of our federal spending is in healthcare. When you think about Medicare, Medicaid, subsidies in the ACA exchanges, other programs, et cetera, this is something that I'm sure the industry is going to be watching carefully to see how they may have to react.
And it affects everybody. I mean, it's a trickle down from the insurance companies all the way down to the manufacturers to vendors and suppliers and things like that. I mean, it's a trickle down effect to everybody the way that's paid. So
as the director of marketing, David, what's the message? What do you want the folks to know about the hospital?
The biggest thing we want you to know is we're here for you. Bigger is not always better. We are 2 years running now, winning award by Care Checks for overall patient safety for overall hospital care. We do a really good job of taking care of our patients. It's personal to us. If you need swing bed unit, we've got you covered. You need a little in-house inpatient stay for a few days just to get you back on your feet, we can do that. We've got behavioral health for Jerry Psych for 55 and up. We've got counseling and therapy for ages 6 and up in outpatient settings. So we've got a lot of pieces to bring to the table, and we're expanding with our healthcare services, with our clinics. We've got 7 rural healthcare clinics spread out from Summerall to Taylorsville.
I know staffing is a huge issue in the industry. It is in every industry. How are you doing as far as retaining your medical staff there?
We're good as far as staffing at Covington County. It's been a little challenge at Smith County. Of course, new business, new venture popping up, and you've got someone who's been in nursing or been in radiology, and they're at a place and they've been there 8-10 years. Well, they may be driving an hour and a half to work every day, but they've been there 8-10 years. They're vested, and it's kind of hard to walk away from that, walk over to here. So it's going to take us a little time to prove ourselves and to prove that we're there to stay, and we're going to take care of folks.
Wages are up in the industry substantially the last 4 or 5 years, aren't they?
Yes. Travel nursing absolutely took the healthcare wages and blew them off the map. It's nuts. And honestly, I don't see how we go back, Gerard.
Well, I hear the same thing from my friends in Jackson that run these big hospitals, just talking about it. Ever since that happened, everything's just through the roof, and they're having to respond to the market realities of that.
Yeah, it is, and it's a response. And I don't know how you get the market back in play. I don't know if you can.
I don't think it happens, honestly. Well, we appreciate, as always, you guys having us here and appreciate the great work that Covington County Hospital does, and also for being a sponsor of our remote today. Thank
Absolutely.
you,
Appreciate the opportunity.
You bet. Folks, we're stepping aside for a break. Coming right back, we enjoyed our visit with David Culpepper, Marketing Director, Covington County Hospital. The Element Wealth Studio has been relocated to Collins, Mississippi today. If you're in the area, we're downtown. You see the big SuperTalk RV. Come by and see us. Coming right back.